morning, everybody, and welcome to Good Morning Calaveras. This is our second event this year, and I just want to say thank you for everybody that has registered. We've had some technical difficulties. Our 1990s projector and sound system went out, so that's why we're, got this whole thing rigged up. And then thank you to Dr. Smart and Wendy Alt for getting printouts for everybody. So as they speak, we'll be handing those out to everybody as well. And up first we have Susan, our CEO of the Chamber of Commerce, to say a few things.
All right, good morning, Calaveras. First off, on behalf of the Chamber of Commerce, I want to thank you all for attending Good Morning Calaveras, and want to thank Twain Medical Center for hosting the event. I just want to take a moment to update you on what your Chamber of Commerce has been up to since last we met in February, and also what we have ahead of us. In March, we started our Leadership Calaveras program. Our first trip was a tour to the Cowboys facilities at Twain and Galt. Our second trip was to the Calaveras Museum in San Andreas, and a wonderful trip to the Angels Museum and Angels Camp. If any of you have not been there, I highly suggest you go. We had docent Tim, and he was just a wealth of knowledge. So our third excursion was a tour of the Utica Power and Water System. Our attendees got to walk on the flume, which was a real highlight, and see what they all do for us, and it's pretty phenomenal. And last week, we were honored to be given a tour of the Capitol by Dana Jorgensen, who is here. Where is Dana? Thank you, Dana. He is with Senator Alvarado Gil's office. And then we visited the Office of Emergency Management in Mather. We're going to be continuing our trips through the end of the year, and then it will culminate with a project that the leadership team will put together, something that benefits the county. So I hope we'll have a presentation on that, and that you'll all come and visit for that. In April, we held our annual dinner and award ceremony at the fairgrounds, where we celebrated our local businesses. Also in April, we held our On the Right Track event at both Bret Harte and Calaveras High Schools. Those were very well attended. Great events for the high school students. In May, we partnered with our local community and economic development department and asked the Board of Supervisors to proclaim the first week of May as Small Business Week in the county. And in conjunction with Friends of the Fair, we held a mega after-hours event at Frogtown the week before the fair. What we have coming up is on September 22nd, I think you guys have the flyer on your table. You can put the date into your phones right away. We have what will be our State of the County event together with the next Good Morning Calaveras event. And we will let you know where that's going to be held. And then October 5th and 6th, we will be putting on our Rural Chamber Summit at Ironstone Winery. And then lots of other great things for the rest of the year. But I hope that you're all following the Chamber on social media so you can keep up with our events and everything else that we're partaking in. And again, thank you very much for coming.
Thank you, Susan. Just a couple shout outs to Calaveras TV for being here filming our event today, and also Upcountry Catering for the amazing breakfast that they provided for everybody. So this time around, Susan and I decided that instead of honoring dignitaries that are here, it would take forever to go around the room. So we're just going to recognize some of the departments that are here. So we have Mark Twain Medical Center Foundation, the Healthcare District is here, our county offices, and then also some great prominent leaders. So, but going around the room introducing every single person will, take a long time. Without further ado, I'd like to call Dr. Smart up to do his part of his Good Morning Calaveras presentation. I'm not going to, talk about him too much because I want him to talk about himself, by himself. I don't want to give away any secrets and stuff like that. But thank you, Dr. Smart. Okay,
I can pass that out.
In a minute. If
Okay.
we pass them out too early, they'll start reading them and not listen to me.
Oh, okay.
Is anybody in here a Giants fan?
Yeah.
Man, are we having a good time or what?
Yeah.
And last night, fantastic. Are they in second now? Do we?
Yes, I looked last
They moved up to
night.
second?
Yeah.
Fantastic. They've won the last 9 games in a row. Last 2 nights ago, they beat these San Diego Padres in 10 innings, great game. And then last night, they beat the Pods again at the bottom of the 9th. And the Pods actually walked in the winning run. Fantastic. Okay, so what I do is healthcare. What I like talking about is healthcare. I'm an internist. I love talking about diseases, stuff that goes wrong inside of you, like stomach ruptures. And I mean, that's my passion. That's what I've been doing for the last 40 years. And I'm not going to talk about that this morning. I'm going to talk about employee management, workforce management. And the reason I'm going to talk about that is I go to meetings and I go around the county, I keep hearing the same thing again and again. It's hard to hire people. It's hard to retain people. It is a really challenging workforce environment. And particularly in this post-pandemic period, I think all of us are a little bit confused about how do you hire people? How do you keep people? Should they work at home? Should they work at a desk? And so I wanted to share, I'm an employer, and I wanted to share our experiences at the district, some of the successes we're having, some of the things we're doing. But I also wanted to share with you some more regional or national information about what's going on with the workforce. I want to start with a statement. If you are in this room, if you are a manager or a leader and you're not involved in workforce health and workforce development every single day, then you're either extremely lucky or you're in trouble. Because you're either going to lose some employees or you have a great organization that's doing well. Hopefully it's the latter. So a little bit about my experience or our experience with employees. In the healthcare district, we now have 35, 38 employees, somewhere in there. Of those 35, 38, there are probably 6 or 7 that work from home. So they are remote workers. We have experience with that. There are 3 or 4 that are what are called hybrid workers. So they work both at the workplace and they work remotely. They do a little bit of both. Like Monday, Tuesday, Wednesday at the clinic, Thursday, Friday at home. So we have that, and then the rest are all healthcare workers that work in the clinic and some administrative workers. So we got a little bit of everything. Good morning. And so only 3 of those 35 actually live in Valley Springs. So what, 30 something of my employees don't even live where they work. Something like 9 of our employees don't even live in the county. They travel from Elk Grove, they travel from El Dorado Hills, they travel from Lodi, Stockton, a couple in Tuolumne, a couple in Amador. So a lot of employees commuting now to the workplace. And our turnover rate, a good turnover rate for employees should be about 7-8%. About 7 or 8% of your employees should probably, they go find another job and you replace them. Currently, nationally, that turnover rate is about 18%. I think you guys know that because you live it. Our turnover rate is about 10 to 12%, so I feel like we're doing pretty well, and I want to tell you some of the things we're doing to make that happen. So that's kind of the perspective on what I do every day and where I come from. There are two reports I would really like to highlight, and I'm going to pass out one now. I'll need a little bit of help. There's some, you're too important to pass them out. So this report is done by Gallup. Everybody knows Gallup. Remember the old Gallup polls? So this report is done by Gallup. It's called the State of the Global Workplace 2023. It's actually a 99-page report, but I only included the US portion of it because it includes Africa, Southeast Asia, South America. But I included the part that I thought was a little more relevant for this group. And in that report, which I'll go over in a minute, there is a major statement, and I really believe this statement. In that report, it says, we have to change the way we manage people. If we're going to succeed today as managers, as leaders, we're going to have to change the way we manage people. And that would probably be my take-home message today, is you as leaders and managers need to step back, say, what am I doing now to manage people and how should I change that? In the report, they do this big survey of workers. I don't know how many they surveyed, but it was a lot. And they break them down into sort of their level of engagement in organizations. And what they came up with is about 1/4 of your workforce is engaged, committed, is on your side, is loyal. And they draw a distinction between being happy and being engaged. So you can be at work and be happy, but kind of not really care about the work. So happy doesn't mean happy at work. Happy means they're just a happy person. But they found that about 23% of workers are engaged, sort of loyal, committed, etc. They found that about 18% are quitting, are actively quitting. I mean, like they're really quitting. I mean, they're like almost quit. But what's important is 60% are not engaged. So 60% of our workforce, if you're the average employer manager, 60% of our workforce is not engaged. And that 60% is the 60% we as managers need to target. That's the 60% we need to connect with. Because they're kind of on the edge. They think, well, I kind of like working for Smart, I kind of like working in the clinic. But there is this other gig over in Amador, that's kind of cool, maybe I should do that. And the benefits maybe are a little better down the street. And those are the 60% we need to connect with. You as managers need to figure out who they are. I have a pretty good idea who they are in our clinic. And I'll talk a little bit about that in a minute. Where's CJ? Yeah, how much time do I get?
You got 20 more minutes.
Yeah, okay, great. And so you need to figure out who that 60% are.
Yeah.
What?
440.
We need to figure out who that 60% are. And you as managers need to figure out how to do that. There's different ways of doing it. In this Gallup report, they describe one of the primary issues with employee discontent or maybe disengagement is stress. and they say, these people are really stressed. Now, they don't say why they're stressed. I don't know if they're stressed because of the work environment, or stressed because of home, or stressed because the world is going crazy, or I don't know why they're stressed. But the number they provide is in US and Canada, 44% of our workers have stress, have significant stress. Not a good thing. You know, going back to my internal medicine thing, if you have stress, not a good thing. If you have stress, probably every medical problem you have, whether it be high blood pressure, ulcers, you know, whatever you have is probably going to get worse if you're stressed, for a fact. So 44% of our workers are stressed. Now, one of the things they did in this Gallup report is they were trying to sort out something we all try to sort out. Is it better to let them work remotely? Is it better for them to be hybrid? Or is it better for them to be at work? And I think a lot of us say they need to be at work. They got to be at work. And what they found when they did this is whether they were remote or at work didn't really change their engagement. You could be remote, be very engaged, very committed, as much as anybody actually working on site. So that discrimination of remote and at work doesn't really change their engagement, didn't really change their stress, and didn't really change their retainability. So as managers, we need to realize working remote may be okay. That may be something we need to embrace. We do it in my clinic. But maybe that's the right thing to do depending on your product, depending on your service, depending on what you do. Maybe that is the right thing to do. But it doesn't change their willingness to stay with your organization. What they also found in this report is that the most important thing for an employee was management engagement. They wanted to be connected with management. They wanted to have a relationship with management. They wanted to talk to the manager, maybe even on their own turf, not in the big office, but maybe at the workplace. So these 60% that are not sure what they're doing and are thinking about leaving, what they're waiting for, sort of, is management to come by and say, hey, how are you doing? You doing okay? How are the kids? How's that thing on your leg? Is it getting better? They're really looking for management engagement. And again, I'll talk a little bit more about that in a minute. And when they looked at the issue of location, like remote versus on-site, when they looked at location versus engagement, engagement was 4 times more powerful than location. I had when I was in the military, I had an NCO, or a sergeant. His name was Wayne. I loved Wayne. And he was a good manager. And Wayne had a phrase called MBWA. I'd say, Wayne, what are you doing? He says, MBWA. MBWA is management by walking around. and it works. Management by walking around works. And so we as managers and leaders, we sit at these desks and we have a big stack of stuff to do. Insurance policies, customer concerns, performance stuff, just on and on. Peggy will tell you the pile on my desk is about 2 feet tall. And growing. But that pile is not as important as walking around. And that pile is not as expensive as walking around. For me, the people in my clinic are everywhere from a high school graduate all the way up to PhDs. So we have some psychologists, PhDs, Definitely have doctors, we have nurse practitioners, we have nurses, all the way down to high school graduates, reception, admin. And they need to be connected with us. And they need to have this perception of community. There is another report that I didn't make a copy of, but I wanted to prove that it actually exists. And this was a study done by the Mayo Clinic. Actually, the Gallup report was produced last week. So if you're wondering, from 2022 or 2021, this was the Gallup report. That's on there. It was produced last week. The Mayo report was more of in a context of healthcare workers. And the Mayo report really said the exact same thing. And the title of this Mayo Clinic report is Leaders That Listen Meet Essential Psychological Needs of the Workforce. So this is the kind of changes managers we need to start thinking about. You got a whole pile of stuff here, and then you've got a bunch of employees that want to talk to management. For me to hire these PhDs and doctors, it actually costs me about $30,000-$40,000 per person to hire them. I don't want to go into the details of it, it's too painful. To hire the high school graduates, it costs me about $5,000. By the time you have administrative time and you have advertising, etc., it costs me about $5,000. And when you compare that $5,000, $40,000, $30,000, $40,000 to the pile of stuff you think is important, it doesn't even come close. So we need to get out and talk to people, figure out who the 60% are, get them engaged, and figure out how to maintain them. Now, I wanted to share with you what we do in our clinic, but just before I do that, I wanted to articulate what the enemy is. And this is going to resonate with everybody in this room. And it just happened to me last week. What we do is we find really good people. We hire them. We train them. We give them these incredible skills. We teach them how to be the best pediatric technicians ever, how to manage vaccinations. And we give them all these skills. We're excited. We're there. We did it. And then they say, well, the guy down the street's going to pay me more, and they leave. We train them and they leave. We train them and they leave. That's the enemy. That's what we're trying to prevent. And all of us, I think, have that experience. So what we do in our clinic, we do MBWA, management by walking around. I enjoy that, actually. Even though I'm an introvert, I really enjoy talking to the employees and learning more about them. We do monthly employee meetings. So every month we meet and we talk. And you can do that in a formal sense, like we have to talk about a new policy or we have to talk about regulation, but you can actually do it in a very collegial sense. How's everybody doing? What stuff is driving you crazy? And you have to listen. You have to listen to two things. You have to listen to what they say, and you have to listen to how many of them say it and how loud it is. The more of them that say it and the louder it is, the bigger problem you have. If it's one or two, it may be a more minor thing. So we have our monthly employee meetings. Our group reviews benefits, wages, a lot. Probably every month, wouldn't you say? Every month, yeah. Yesterday we had a meeting, we're looking at providing more paid holidays. So we look at the benefits and wages. We use the performance feedback. We try to craft that in a positive way. Now you can't always do that. There's people that have problems. They need to know they have problems. But the more you can the more you can craft that performance feedback in a positive way, in an interactive way, I think the better. So we do that. We give them food. Food's important. So last Wednesday they had a particularly busy day. They saw over 150 appointments. They were not easy appointments. There was some tension in the clinic. So the next day I spent $100 on pizzas. I think I bought 8 pizzas. But you know, the $100 really goes a long ways. And every single one of those employees came back and thanked me. I provide gas mileage. So in our clinic right now, we have two nurse practitioners that are in their internships. And I think those are going to evolve into employee contracts. We have one social worker who's no, not a social worker. She is a LMFT. No, she's an MFT, non-LMFT. I think that's going to evolve into an employment contract. We work with, what's it called, Peggy? CTE?
CTE.
Yeah, we work with CTE. We have a couple of high school students in the clinic. We show them our radiology department, our lab. We kind of find out what they're interested in. But the idea of growing your own, I think, has a lot of merit. I think it's something people should really take a hard look at, is how can you get these students or trainees in your organization, create a good experience that maybe evolves into ultimate employment and engagement. I think that's something that has a lot of value. We have an annual picnic. I usually tell jokes. That doesn't go very well. I actually think they're funny, but some people don't. So we have an annual picnic. We do some awards. We do some recognition. I think, you know, for me to do that annual picnic costs, what, about $2,500? It cost me $5,000 to hire somebody. You know, it's money well spent. So that's what we do in our clinic. That's how we got to a turnover rate of about 10% versus the national 18%. There's things we could do different, and I'm going to wrap up with the things we could do differently. Daycare is a big deal. And I don't think any of us individually can provide daycare. I don't think. Maybe you can. I don't think I can. But for example, Doug and I could partner. Or Doug and me and Wendy could partner on some sort of consolidated daycare service where people can have a place to put the kids and still work. And I mean, that's doable. That's partnership, collaboration. I think that has a lot of potential. The other thing we can do is we can exchange applications. Let's say I get an application, it's not really what they're looking for. I can send that application to some of the other healthcare partners in the county. We can exchange those applications. We don't do that right now, but we could. And then we can, you know, if we really wanted to get ambitious, we could do job sharing. Pretty hard to do. I'm a public agency. Wendy, you're a government. Doug, you're a nonprofit. But there are job sharing things we can do. So let's say I need a psychiatrist. Well, I probably personally do need a psychiatrist. But let's say my organization needs a psychiatrist. But let's say I only need him or her 2 days a week. Maybe Wendy needs him 1 day a week, and maybe Doug needs him, or your organizations, I'm sorry, need him. You know, we can give them a full-time job if we do some job sharing stuff. Not easy, it's contracting, it's the way you contract is way different than the way I contract and you contract, but there's potential out there to do these kinds of things, and we should think about them, because as Calaveras County, we're a community. We're trying to keep people here, we're trying to provide service, and the more we can do that kind of collaboration, and the more we can work together, the more successful we'll be. And I'm all about being successful. So I'm going to wrap up with repeating 2 things I've already said. One is we need to change the way we manage our employees, our people. And 2 is we need to have leadership connect with every single employee in a meaningful, compassionate way. We need to listen. So that's what I have this morning. I don't know if we have time for questions. CJ says time for questions. But that's what I have, and I appreciate your attention, and I appreciate all that you do for our county. Yes, sir.
Do you think that the need for recognition is important and motivating and making a happy employee? In other words, recognizing their achievement, perhaps having an employee of the year, or recognizing every time you have a person is successful at something, that would seem to motivate a person to stay because they're solving a need they have, and that need is for recognition.
Al, I totally agree. The employee engagement thing is really about emotional health. I mean, if you were to try to capture that phrase a different way, it would be their emotional health. I think recognition is really important, but I think you can go overboard with recognition. My personal opinion, I don't have any data on this, but I think if everybody gets something, then it doesn't mean as much. So you kind of have to find that line as what is the appropriate amount of recognition that doesn't undermine the value of other employees, like I'm not very good, I didn't do anything right, I didn't get an award. It really requires leadership to do recognition right. But I absolutely agree with you. I think that's important. Are there other comments or, okay. So can I just turn it over to Wendy?
Sure, I'm going to make a quick comment for you.
Oh, okay.
So Larry Cornish has one employee that he oversees, and that's me, and he tapped on my shoulder to check in if I was engaged. So I think your speech is going very well. People are already implementing it. So thank you, Larry, for checking in on how I'm doing. I appreciate it. And then the number 2 question was, who and where do you get pizza from? Because our table was wondering, you got quite a deal on pizza as well. There you go, round table, guys. So that's where he's going. Up next, we have Wendy Alt. Wendy, come on up.
Trust me.
And your jokes are funny too, Dr. Smart. You don't sell yourself short.
Thank you. Good morning. Thank you for having me. Wendy Alt, Behavioral Health Director for Calaveras County, Deputy Director of HHSA, Health and Human Services. So CJ told me that I would have this lovely presentation that you could look at instead of me, but that's not going to happen. So bear with me, because really, I'm a therapist, so talking to this many people in a room is not what I do. It's usually one-on-one, and I let the other person talk. So I grew up in Yuba County in a small little town called Olivers. I don't know if you know of that place, but it's tiny and low income, poverty, single parent household with substance abuse, domestic violence, all of the things. So I could talk to you about broken families, addiction, depression, loss, survival, grief, heartache, death, abuse, neglect, abandonment, suicide, and betrayal. But I can also talk to you about empathy, kindness, compassion, love, energy, forgiveness, healing, recovery, unity, gratitude and grace, hope, and the power of positivity. All of these experiences have taken part in creating the woman I am today and bringing me to behavioral health. I started my career going down the path of law enforcement. I thought that I didn't want to be anything like the world I grew up in. And so I did that for quite a while, went through the police academy. Then I had to take in a younger sibling and the hours didn't quite work. So I decided, well, I'll just switch over to probation where I still get to do law enforcement. Finished my master's degree and due to family circumstances, ended up in Calaveras County. Luckily, Sam Leach was the chief then, and he was like, go ahead, come on over, we'll bring you to probation. It didn't actually line up the way that I thought it would. So I said, well, I guess I'll go get my hours as an intern therapist. And now I've been with behavioral health ever since. And I really don't think that there's anywhere else I'd rather be. I get to still go out into the field. You'll see on the front cover is me in a bulletproof vest still, but for behavioral health reasons. It has been an adventure learning how to combine both of those areas, but I can't say I wouldn't have it any other way. The team that we work with here in Calaveras has been great on helping us really work together, from probation to child welfare to our sheriff's department and the jail. We recently had to have a doctor come from Sacramento County to evaluate one of our inmates, and he called and he said, I'm busy, don't take this the wrong way, but I would love to come out and continue working for you in your jail. And I said, well, it's not my jail, but thank you. And he says, but I don't think you understand the atmosphere there and the care that the COs have for those that are in the jail. That is completely different than any other jail I've ever been into. And I think that has a lot to do with the staff that we have at Behavioral Health and the relationships they've built with those individuals. So teaching them mental health first aid and that there's a way to get through these crises. So I just wanted to share that piece. So in Calaveras County Behavioral Health, we serve insured, non-insured, and mainly the Medi-Cal individuals in our county. We have substance abuse counselors, we have psychiatrists, and we need them every day of the week, 24 hours a day, 7 days a week, let me tell you. Fingers crossed that we get one in person someday soon. We also have peers, so those individuals with lived experience. We have administration support, a few in the back, Morgan over there, who runs those billing and the back side of the scenes. We have case managers, therapists, and all of these individuals have a deep knowledge for the needs of recovery in our community and really give their all in working towards providing that to the clients that come in. We currently have 63 employees in behavioral health and several other contracted providers. We provide mobile, field-based, and community-based services, as well as specialized outpatient and crisis directly and through contracted providers. So I say crisis, but that also means maybe you're not in a crisis, but you just really need to talk to somebody that things aren't going your way. You are always free to come in or call. We work closely with the hospitals. I know Kara and Doug love when they see my face come over here. Not really, but we work really well together. The schools, one of the programs that I'm probably the most proud of is our wellness centers that are in our elementary schools. So the elementary school students are able to go into a center and get the therapy that they need or just engaged in services, and it helps the parents go to where their kids are at instead of having to come all the way to San Andreas. In your packet, there's a flow chart that several of us had to get together, so law enforcement, the schools, probation, and really talk about what it looks like when we have a call for a child in crisis. Prior to this, what would happen is the sheriff's department would get a 911 call, and all of a sudden a deputy would show up and would probably be walking a child off campus in handcuffs in the back of the car. The sheriff's department said, we don't want to do this. And everyone else said, well, we don't want you to either. What could we figure out? So we sat together for a long time to make sure that in what we did made everyone safe and that there was a plan for this child and the family when they're returning to school and what that process looks like. So behavioral health directly or indirectly touches the lives of almost everyone in the state. About 3/4 of serious mental illness first appear before the age of 25. This makes children and adolescents particularly vulnerable, and we've seen such an increase in these numbers since COVID. They're still trying to figure out, why, what was it, and does it have to relate to social media? But if we can't figure out what that is in that early childhood time, the likelihood of it increasing as they get older is drastic. And over the past decade, the state saw hospitalizations for mental health emergency spike more than 40% among our young people. So substance abuse is interwoven with mental illness and makes it really difficult for us to determine what a diagnosis is. Most of the people, I would say 98% of the individuals that experience a substance abuse disorder actually suffer from trauma and have just continued to use medication as a way to cope with whatever it is they're going through. A third of adults who received county mental health services for serious mental illness have a co-occurring substance use disorder, and the stakes for these individuals are 6 times more likely to attempt suicide than those without. So another one of the issues that we face are that jails and prisons have become the default psychiatric institution for individuals with mental illness. Currently, we have a really, really good system here where a lot of the deputies or the officers at Angels PD will call us and say, hey, we have this person, and yeah, they committed a crime, but we really don't think that where they belong is in jail. So we figured out a way, okay, well, we'll have our case manager roll out to do an evaluation, and perhaps we could get the person hospitalized and medication and stabilized so that instead of going to jail, we can get them back on track and they can be productive in our community. Sometimes that doesn't work. Sometimes they get stuck in jail, and then we go through those processes while they are in jail. Probation has helped us really come along and have a therapist in the jail provide programs to individuals so that when they are ready to come out, they can function as well. So the emergency rooms across the state, just due to the increase, are also feeling the pinch. People in psychiatric crisis are increasingly landing in the state's emergency rooms again and again. It's usually over and over because there's not anywhere else for these individuals to go. It's not a good environment, not that they're not wonderful nurses and doctors, but this is just not where somebody should go when they're in a psychiatric crisis. And it can sometimes intensify those issues. And here in Calaveras, we really don't even have a psychiatric facility close enough to take these individuals to, so they may spend 3 days or more in our ER, which ties up the ER staff and all of that. So it's our goal to get in and get this individual stabilized and placed at a psychiatric facility, but most of the time that's calling up and down the state where we're contracted with to find a bed for them. So one of the big issues for behavioral health right now throughout the nation, not just Calaveras County, is the fact that there aren't any workers coming up through the system. And the age of the current workers is almost to retirement. So we're going to see a big push of individuals leaving and not enough coming into the behavioral health system to work. So if you know anyone, please send them our way. The state is doing a wonderful job throwing money at us, saying, hey, here's all this money if you could get individuals to come. So there's funds to help pay for education if you have somebody that's interested. So there is like this, you better sign a 2-year commitment and not leave us for at least 2 years. But there's amazing opportunities, and if somebody just wants a tour to come learn about it, we'd suggest that as well. And then a lot of providers, and I feel even bad saying this because I do this as well, do not accept insurance. So if you go to find a therapist and they tell you, sorry, I don't accept your insurance, it's because that hassle of trying to be a provider and work with the insurance, it's easier for that employee to say, I'd rather just take cash. It's a lot easier, but then who can afford that, right? But that is one of the biggest complaints for individuals that are going or that are in the behavioral health system.
It's also against some regulations to not collect the deductible if you do run it through. So even though your heart may be in the right place, you have to run a business like a professional business.
Correct. I know, I'm horrible at it. I could probably never go into private practice because I really don't feel like you should have to pay to be okay. But hopefully someday the state will throw the money that way as well. So a few things that we have underway at the very last page is CalAIM, which is an amazing opportunity. I really love seeing all of the things that are happening through the state. It just really, really sucks that we don't have the people to help us implement those things. But the whole way that we do things is changing. We have a whole documentation reform, the way eligibility criteria is. If you step foot into our buildings now and say, hey, I really need help it's our job, we are mandated by the state to make sure that you get that help. If it's not with us, we have to hold your hand until we find a provider that you are connected with, which is nice, right? Instead of, hey, sorry, you don't qualify here, go 10 streets down or another county over. Currently, all the work that we do in the jail with inmates, we are not able to bill for, which is tough for us because we are a non-general fund, and the way that we sustain is through Medi-Cal billing. So the state has also granted California a federal waiver of implementing a 90-day in-reach. So we will be able to bill and get people connected while they're in custody, so there's not a lapse of when they're coming out. So, hey, glad you did all this work in jail, but we'll see you later. Now we'll be able to make sure that they have that in between. 988, that's a huge one for us. That is the switch over from 911 and 988 being for behavioral health calls. Currently in Calaveras County, the 988 number just goes to our crisis line. We still go through dispatch of 911 and don't know really if we'll make that switch or not, just due to our rural area. It's really hard for behavioral health to have a dispatch center that says, oh yeah, I'm gonna send you way out here. So just duplicating those efforts in Calaveras County almost just doesn't seem reasonable. We have been awarded a $2 million crisis mobile unit award, and so right now we're working on having a van to go out to the field and help the individuals that are in crisis. And then one of our biggest ones is the BCHIP award. We were able to secure a $22 million grant for a new behavioral health infrastructure. So if you know where we are, we're the trailers out back, way out back. So by June 30th of 2027, there should be a brand new 2-story behavioral health building where people enjoy to come and feel happy to be there. So that's exciting. We're also working on medication-assisted treatment, so individuals who are in the process of wanting to get the help to come off of, yes, so exciting for some of us, huh, Kim? Instead of saying, sorry, figure it out on your own, here's a program you could go and learn about all the, what substances do to your brain. This helps you in a medication way, but so that's our hope that that gets implemented in the jail and outside of it. And then we are currently waiting to hear on a behavioral health bridge housing grant, which will help us continue to place individuals that are in our behavioral health system. Any questions? Yes, sir.
I understand that up to age 25, you could tell if a person has behavioral health problems. What percentage of our population is in that category? We have 45,000 people in the county.
The ones that are served by behavioral health in the county?
Yeah.
Under 25?
25 people?
No, I thought you said under 25 years of age. Are you talking about the youth?
As a means of identifying people that have behavioral problems, I think you said up to age 25 it becomes apparent. And well, my question is, how many people actually have that problem among our population? Are we talking about 10%, 5%, 2%?
So we have served in our elementary schools, which they may not have a diagnosis yet, but behavioral health has worked with them, over 400 unduplicated children in elementary school. Our numbers for total served last year is 600 individuals out of the county. So
including the
separated out from the wellness. So we're over 1,000 at this point for all of our individuals.
Okay, thank you.
Yes, ma'am.
I don't know if it's possible or not, but I was listening to Dr. Smart talk about the CTE, the Career Technical Education program that we do through the high schools. Is it possible for you guys to implement some of that and maybe grow your own?
Yes, so we do currently have interns. It's a little bit harder for us just because of all the regulations, and we have to be able to provide that person with the same system that a regular employee would, but we have an intern right now, and our fingers are crossed. Please stay with us after, because you're wonderful, but the same thing sometimes. I mean, if you look at what a therapist gets paid for the county, and then you go look at private practice, right, it's not even comparable. So, but we're trying. we try to make it happy. We do a yearly mental health day appreciation. We have an annual event where we all get together. We usually learn something in the morning, have a presenter, and then just roundtable what everybody likes to see. We have Employees of the Year. So this year, Lindsay Racine was our employee, where she had to hold down the front desk of substance abuse by herself because her partner was out due to medical reasons, but she has done a wonderful job. And so we try, and yes, believe and grow your own. We were ready to take a younger, I think, high school student, and right now it's just really hard with everything that's changing in our world.
Also, though, the county is working with both Bret Harte and Calaveras High, and we are bringing high school interns in. And this summer, we're working with Motherlode Job Training to bring in youths for work experience. In fact, our public access TV will have 6 working with them to do projects throughout the county.
Nice.
One of the issues that I've experienced in our community is when someone is in crisis, the family has a hesitancy to actually call for a 5150 because they're thinking of what the future repercussions of that are going to be. And I noticed in here, there's a 5150 versus a safety plan. So how would someone go about a safety plan versus a 5150?
So it's really hard, right? If the person states to whatever that crisis worker is that they have a plan to kill themselves or someone else with the means, the intent, and it's all out there, we have no choice but to put them on a hold to protect them and that family that they're probably with. Usually after a lot of work, the individual, once they get placed, they understand why they were there and come out once they're medicated and in a better situation. I do know sometimes it's easier if we have behavioral health show up, but sometimes for safety reasons we have to have law enforcement, and we know that's a trigger for somebody that could be experiencing a psychosis. But we've worked it out really well to, okay, let us go in, let us make sure everything's safe, talking to the family member, providing the follow-up information. We do get people that are scared, okay, where are you taking my child, even if it's an adult child, right? So walking them through those steps and saying, okay, and here's what you're going to do when they come out of that. And if you don't feel safe having them back home with you, what are our options then? But it is a scary space to be in. And so we like to have peers also talk to the parents of individuals and say, okay, here's what we did, here's what's worked for us.
And I think the other issue is, I think parents or family members that are experiencing, that kind of suicidal crisis at that moment. If you 5150 someone, that has the potential to really prevent them to go into certain fields of work while they're working through all of that. So that has also been something that I think there's been a hesitancy for family members to actually pull the trigger on that one.
So it should not ever, unless it could be, if it's law enforcement related, right, and your guns are taken away, yes.
Yeah.
So what we have is, so if you're not at that, let's say that it's mild, right? There's thoughts of suicide, I'm kind of depressed, I don't want to be here. There's other options where it could be the crisis residential unit where you're going voluntarily.
So I guess I think people don't necessarily know how to get there. So they don't want to call 911. And so they just try to figure it out.
Yes.
Which then doesn't obviously work out very well. And so I think trying to, get more information out there that's available that we can share when we come into that particular kind of crisis to provide that information to people would be really helpful.
Okay.
Because there's been situations where, we find out about it later and we're kind of like, you probably should have just called, but they didn't want to, and you can't force them to. But if there was an alternative of some way to get help, then that may be helpful. Yeah.
So Cody currently is our triage case manager who goes out in the field and usually has a partner, but that individual has moved over to a therapist position in the jail. So right now, Cody and I are going out, but if you call and say, hey, I have somebody that's on the fence, we'll go out and meet that person and just kind of talk through. And if it's a family member, to say, here's what that process looks like. And not necessarily make contact with the person in their episode, but kind of walk through the family with it. Yes, sir.
About a year ago, Doug and I were working on an issue of how to transport the 5150 patients from the ER setting to an inpatient therapeutic setting. And we ran into this issue of the caged cars, which really bothered me because they're sick people, they're asking for help, and my understanding at the time is we put them in these cages at the time where they need the help the most. And I think we realized that actually the insurance payers are required to provide that transportation, which could be done by ambulance, which would be a more compassionate sort of thing. Are we still doing the cage cars?
We are.
And I can kind of speak to that because that tends to be my folks, my probation folks that end up transported that way. And a lot of times it's just too dangerous for the ambulance drivers to take them.
So you are talking about two separate things.
We are.
Yes, I know what you're speaking to, and currently it is an issue throughout the state. Right now, there's not enough ambulance drivers, right?
Yeah.
And so if we call and say we need a transport from Calaveras County to the Bay Area, the closest psychiatric facility we can find, we now take that ambulance out of our county, right? And so it's a tough space to be in. And the only option right now was, okay, well, we can provide you with this safety car because then at least our ambulance is in the area and could get to an emergency if needed. You're right, who wants to be in the back of a cage car when they're just, you know, I just told mom I didn't want to live anymore. It's sad, it's scary, but there's not an answer to it right now.
There's not a good solution.
Who transports those people? Like bailiffs or officers?
American Legion.
Oh, it's American Legion.
The contract with AMR, yeah, currently. And they were the only one that would contract with us too, by the way. So it's not like we had any options. Yes, sir.
So I know there's a lot of excitement around the new behavioral health building. Can you talk a little bit more about that and share kind of what the plan is, what it's going to look like?
Yes, so currently we have several different sites spread out San Andreas. We have the portables that I talked about earlier where the building is planning to go. And then we have our children's area over by Pizza Factory, and our wellness center for our day program is also in that same complex. So we have several different sites that it'll be able to bring everybody back to the campus. There will be separate entrances for adults and children, different things like perinatal. So if somebody is experiencing behavioral health and substance abuse issues, they can bring their children. There will be a daycare center for them. It's part of the program from the state. We're going to have community rooms and then individual offices. Currently, right now, if you go in and you see a therapist, you have to have this noisy whoosh sound machine because you can hear everything through these paper thin walls. So we're excited. The clients are super excited. We hope to do more community events and outreach once we do have a co-located area.
When do you break ground?
We're still working on it. There's still several steps. All I can tell you is that if we're not done by June 30th of 2027, the funding stops and we're still required to pay. So. We did just get an additional grant towards, so part of the 22, you have to have a match, and we were able to use the land match that we have now, but that only covered half our match, and so we applied for an additional grant, and we're able to get another $500,000 to go towards that match. So there's also an opioid settlement, and those funds will be able to be used towards the substance abuse side of building. So.
Is this building going to have any type of not residential, but short-term housing, or a few beds, or?
No. We used to, quite a while back, contract with Amador County and their hospital. They were not able to keep enough employees to work it, so it has closed. It's really tough right now. Right now, we have the crisis residential unit, which is in Merced, and so we do drive all the way to Merced and place individuals there for our crisis stabilization right now, but there's nothing close to home. Yes, sir.
Do you do fundraising?
I'm gonna have to, because with that grant, I don't get furniture. So you might see me on the corner with a bucket or a high heel or something, you know, trying to get some money. Yeah. So. And I'd like to thank Mark in the back. He is part of my behavioral health, mental health board. He sits on that and can probably speak to anything if you have any questions for him as well.
I do have a quick question. The homeless population in San Andreas.
I thought I was going to get out of here without that one.
I'm asking you a nice question. I know some of them are by choice because I see them for a short time and then they're gone. But there are those that we see on a regular basis. Are you in touch with those? Are some of them that are here long-term by choice, or is it actually a mental state that is preventing them from?
So usually it's a dual diagnosis, right? So usually there is some type of behavioral health and then substance abuse as well. But we still don't stop, even if they tell us, get lost, pound sand, we don't want you. We continue to go out and say, hey, come on, aren't you cold? Don't you know it's gonna get cold or it's gonna get hot? Or, you know, we have these options for you. Let us drive you down and check it out. It's tough, but the work that these case managers do that you really don't ever see, because they do it behind the scenes and quietly, because nobody wants to see anyone from the government showing up during the day to, you know, the area. But they constantly try and try. We do have a new care court coming through, but it will only serve a tiny, tiny population, where if we have an individual that's out there and they have a history of schizophrenia or along that spectrum, we will be able to mandate treatment. And if they're accepted into care court, behavioral health has to have housing for them and find it. So I'm hoping that that helps a few of our individuals, but again, it's just the judge saying you have to listen to behavioral health, and sometimes that's not enough, but we'll keep trying.
I know that there was some legislation that they were trying to reduce the threshold to give behavioral health more leverage on forcing that. Is that still kind of in the?
That's part of care court.
Okay.
And so that's making sure a lot of that crosses over with our public guardian side of things, right? So if somebody doesn't quite meet that criteria, but they still meet all these others, then we can hopefully step in. The governor is currently working on redoing MHSA, so Mental Health Services Act, where a lot of our funds come from that aren't Medi-Cal, and a piece of that is housing. Like we said before, the behavioral health and the substance abuse side of things is the majority of the issue for the individuals that are homeless. So in a way, I think that's where they're trying to get through that door to say, okay, let's serve them anyways, because homelessness is a #1 issue. So fingers crossed.
Thank you. Thank you, everybody, for attending. Just a reminder, September 22nd, 2023, to save the date for State of the County breakfast. We will not be having a Good Morning Calaveras breakfast, and instead we will have the State of the County breakfast and the dates to follow. Once again, thank you, everybody, for joining us. Have a great Wednesday.